Good morning. I would like to talk today about Alzheimer's disease. As we all know, it is a progressive degenerative disease. What main thing we need to focus is there is a loss of memory and intellectual function. Now, what patient presents when patient come to clinic, what it could be the complaint. So I will just tell a brief, usually common problems. Particularly, I have seen a few of the Alzheimer's patient and would like to go accordingly. Patient will tell that they have recently starting forgetting the things, short-term memory loss. They have difficulty managing time in household thing, take long time in getting ready in the morning, or just forget the way to home. Maybe they have many times history of fall, or usually they are more agitated, irritable. They just roam in the during the late time of the day. I mean, there is a sundowning effect it calls. Probably get disturbances, confused, agitated. Now, these are the common complaints, and for the our perspectives, we know it is a degeneration of neurons. There will be a neurofibrillary tangles and plaques in the cortex, and it affect the cortical and subcortical function. Now, we need to remember precipitating factor, mainly aluminum toxicity, Down syndrome, or a traumatic brain injury. Now, for the common signs and symptoms, what we need to remember is mainly two things: loss of intellectual function and loss of memory. Again, most common thing we can see is language problem, then attention problem, also motor skills problem. They have a difficulty in perception, the things, perceptive disorders like agnosia and things. In the language, there is no words. I mean, they have to think before talking. Also, they elaborate the thing. They don't speak straightforward. They are more frequently irritable and agitated. And now I want to more focus on the two things. One is the two type of the Alzheimer's, and that also mainly dementia in Alzheimer's and their treatment. So we have probably three types, right? One is the senile Alzheimer type dementia, one is presenile Alzheimer type dementia, and one is multi-infarct. So first is we understand now senile dementia, name itself says that senile is for the older people, probably age 60 plus, and presenile is younger people, probably 40 to 60, whereas the multi-infarct, it is probably 55 to between 55 and 75. Now, this is the age. If we go again for the more detail, thing is like senile dementia, it is a gradual, whereas the presenile is a rapid onset, and the multi-infarct, it is a sudden onset. If there is some problem like stroke or anything, vascular problem, it would be a sudden dementia. Whereas older people, they just start progressively go more worse, and presenile are rapid. And more important thing I want to focus is on the cortical function, how they impaired. So when we are thinking about the cortical function, higher cortical function, what are the functions comes in the higher cortical function, like um judgment, thinking, decision making, right? So this would be in the multiple infarct dementia. It would be people have some insight, whereas senile or pre-senile Alzheimer type dementia, they don't have any insight. And multi-infarct people have some kind of confusion with a lucid interval, so they will get better off in between. Whereas a senile and pre-senile, they are progressively deteriorating. They are disoriented, memory loss, impaired cognition, impoverished thinking, hallucinations, delusions. For the affect, emotional liability, anxious, depressed, and also they have personality change. Whereas in the multi-infarct, you won't see much personality change, but in the senile and pre-senile, personality change you will able to see. So this we just differentiate, a brief differentiation between the dementias. Now if we go for the treatment, first thing that if patient is coming, patient has a memory loss, so what we will do, we give more kind of charts, calendars, and so that they can remember the things. We will teach exercises in a manner, in a very slow manner and repeated manner, so that patient will able to cope up with the strategy. Now this people have a learning problem, learning disability, language problem, so we need to be very slow, repeated manner and teaching. And also we can use charts or demonstration kind of thing, rather than just speaking and just explaining the exercises. Also they need a very friendly atmosphere, they need support. Psychological support is very important. We need to give calm, friendly environment. Also calming strategy will